Hi everyone, welcome to our podcast where I, Louise, interview experts to help me understand more about CBT. Today we have Simon back on the show. For new listeners, Simon is a mental health doctor, a psychiatrist, and knows a lot about CBT. In our last conversation, you told me that CBT helps us reflect on the relationship between our thoughts, feelings, and actions, and that a CBT therapist would help me recognise negative thoughts, feelings and actions and help me find the positive ones. Today, I was wondering if you can tell me about what kind of problems CBT is used for.
Absolutely, yeah, and that's a really good summary to begin with, Louise. CBT is used for a whole host of different conditions. Most commonly, it's used for depression and anxiety. And it's often the first line treatment, which means sort of the first port of call for those conditions. And that's because it can be really very effective. It's also used for things like phobias, OCD, obsessive compulsive disorder, social anxiety, insomnia, issues with sleeping, and a whole host of other things. The content and the specific challenges might change, but the core principles are the same in each case.
That's really interesting. I didn't know that CBT can be used for so many different situations.
Absolutely. It is worth saying that the specific offering by the NHS Trust that provides your CBT may vary from trust to trust, and it's worth checking the Trust website to make sure that the condition that you have is actually something that can be treated with CBT in your area. But often there's a wide number of conditions treated with CBT, even physical health conditions like chronic pain, fibromyalgia and irritable bowel syndrome can be treated with CBT. In these cases, it's not about curing the illness, but it's more about reframing the person's relationship with that illness that can in itself make them feel better.
I really didn't realise there were so many applications for CBT, but would it change how the CBT therapist runs a session?
Yes, so in different situations, CBT therapists might suggest slightly different techniques. For example, with a phobia, something like fear of heights, the therapist might initially focus on challenging any negative beliefs around that phobia, but also may confront the phobia through a sort of gradual exposure to the trigger or the cause of the anxiety. And that's a process that we call desensitization. So there's a whole toolbox of techniques and exercises that can be tailored to the specific individual. And that's another key thing about CBT, is that it's personalized. So the therapist will always be working with you for your specific challenges.
So these personalised techniques help us feel better when we're doing CBT, but can it really help us stay better?
It's a great question. CBT can be really helpful beyond just the duration of the sessions themselves. The techniques that you learn, which I hope we will go into more detail on in later episodes, can be used for the rest of your life. Now, everyone's circumstances are different, and having CBT doesn't mean that you won't need support for your mental health at some point in the future. But for a lot of people, it will have a really positive effect, and that's been shown in extensive research that backs CBT.
Thanks, Simon. Another really useful conversation. It's so great to know that CBT covers so many situations, and really encouraging to hear that we can use our CBT skills long after our therapy.